Hi everybody, welcome to this video. Today we're going to be talking to Dr. Steven Lipshultz. He is our research recipient, and I wanted to give you a little background on how we met. When Sofia was 5 years old, back in 2004, 8 months into treatment, she had her first bout with heart failure. When we were at the cardiac ICU at Miami Children's, the head doctor, Dr. Rossi, mentioned that coincidentally, 6 months earlier, the world's expert on heart failure caused by chemotherapy had just moved down to Miami and was the chairman of pediatrics at So I Googled him right away. Within hours, I was shocked and amazed, grateful. He responded very, very quickly, and we met with him a couple days later for about 4 to 6 hours, if I remember correctly. He went through every single page of Sofia's medical records, which was good 3-4 inches thick, and gave us a scenario and gave us the background on what could possibly be happening to her, what probabilities for the future there were, gave us course of treatment, which was very new at the time, and Miami Children's wasn't even offering it to us, and so he's the one that wrote the letter and told them what to do. And so that was sort of the beginning of our relationship. And one of the most interesting things for me is that in that conversation, one of the scenarios that he played out for us in terms of what could happen is that some kids, after the initial bout, they do well. And then about 7.5 to 8 years later, they'll have another bout of heart failure, and some survive, some don't. As much as it pains me to say it, because he was very, very right, that's exactly what happened to Sofia, because it was about exactly 7.5 years after her initial bout that she did pass away. So in my mind, he is definitely the world's expert. Your work is as important today as it was 20, 30 years ago, and it will continue to be important another 20, 30 years, because we're going to have all these kids. Where do you want to take it? How do you want to take it? What else needs to be done, and how do you want to go about doing it?
Yeah, no, thanks so much. I mean, I think that what you're talking about is there's two groups of children. Those that in 2018, 2019, 2020 will sadly be newly diagnosed with cancer. For those that receive anthracycline, the goal is to offer the cardioprotectant, the dextrazoxane, right up front as they're receiving it. We are now, because of the work of Sofia's Hope, we've been able to actually get an increasing number of doctors who write the protocols for children who will be treated for the next 3 years with this to be putting dextrazoxane in, not really as a research question, but as an effective treatment. And since these children will be followed on protocols that we will see how effective it is, we'll be able to assess that. But to offer this in a more broad way to children that would not have otherwise ever had the opportunity is a big part of what we're doing. And that's where the support that I've been blessed to get from Sofia's Help really has made a big difference at enabling us to share the data and the information with the agencies, the doctors, the governments, the National Cancer Institute, others that write the protocols and treat the children. And so implementation is a really important part of really making sure that at the bedside a patient gets it, so you can really prevent. And so that's a big part of what's happening. And in fact, just in the last 6 to 12 months, again, because we've had support from Sofia's Help to have us at the right place at the right time and sharing this and communicating as a bunch of medical scholars that have questions and have answers and dialogue. The nationwide protocols from St. Jude Research Hospital, the protocols from the Children's Oncology Group for children newly diagnosed with AML are now, for the first time, moving forward using this, and they had not used it before.
So it's sort of mandatory. I mean, not mandatory, but it's part of the protocol, and you should use it, and you have to. It's no longer a question of your child's oncologist deciding yay or nay about using it. If your child has AML, they must use it.
Exactly, and so that is key. The other thing that we're trying to do is for certain childhood cancers, like I mentioned earlier, childhood acute lymphoblastic leukemia, the most common malignancy from 2 to 18, we've seen incredible proved outcomes with, like I said, up to 90% 5-year event-free survival. But for other groups of children, so children that have bone cancer, osteosarcoma, some of those children don't look forward to active, productive lives with 90% survival. Some subgroups get as little as only 20% getting survival from that. And for those groups, the anthracyclines are actually very effective and helpful for some of them. So the thing is we've always had to limit the total amount of anthracycline that's helpful, because if you give too much, it will lead to heart failure. Now, what we were able to show in the past 2 years is that for some of these children, if we treat them with anthracycline and give the dexrazoxane before every dose, we can give substantially more anthracycline and do it safely without getting heart failure. And again, with the support of Sofia's Hope, we've been able to get that work analyzed, get it out, and share that with the world.